welcome to the artistry and techniques of non-surgical facial rejuvenation. This 2.5-hour CME-certified online program features instructions on patient assessment, demonstrations of injection techniques using hyaluronic acid-based dermal fillers and botulinum toxin, as well as practical clinical commentary by members of the Palate faculty. These experts represent the fields of dermatology, plastic surgery, and ophthalmology. They have developed this self-paced educational activity and resource on non-surgical facial rejuvenation in order for clinicians to improve their patient assessment skills, refine injection techniques, avoid the incidence of and effectively manage complications, optimize treatment outcomes, and increase patient satisfaction. This educational activity features facial mapping and marking, 180-degree high-definition before and after treatment videos, volumization of the upper, mid, and lower face, an array of toxin techniques, 2 pan-facial rejuvenation cases, and clinical pearls from the Palate faculty. To access the full program, please click on the Artistry and Technique of Non-Surgical Facial Rejuvenation tab on the homepage of www.palateresources.com.
We are pleased to present Advances in Medicine, our review of significant stories affecting the world of medicine. And now, here's your host, Dr. David M. Simpson.
Greetings, and welcome to Advances in Medicine. To start our program, I want to mention a recent study on the use of botulinum neurotoxin in patients recovering from stroke. We want to speak now with the FDA for some insights. With us today is Dr. Bob Rappaport, the Director of the Division of Anesthesiology, Analgesia, and Rheumatology for the Center for Drug Evaluation and Research. Welcome, Dr. Rappaport.
Thanks, David. It's a pleasure to be here.
Bob, can you briefly define REMS and give some examples of the components which can be involved in REMS, as well as REMS programs currently in effect?
Risk evaluation and mitigation strategies are a component authorized by the Food and Drug Administration Amendments Act of 2007, which authorizes the agency to institute strategies.
Hello, I'm Robin Cook. I'll be your host for the first in a series of programs that explores a remarkable substance, botulinum neurotoxin. The supreme irony of this infamous product of Clostridium botulinum emerging as a valuable medicine fascinates me both as a physician and a novelist. In my novel Toxin, the foodborne culprit produced by E. coli had no redeeming qualities. Botulinum neurotoxin is different. In its purified form and at minute doses, it is not only perfectly safe, but can produce dramatic clinical benefits in an array of disorders associated with muscle hyperactivity. Our series begins with an investigation into the basic science of botulinum neurotoxins.
Botulinum neurotoxin enters the nerve cell via acceptor-mediated endocytosis. The toxin remains housed in a membranous vesicle.
The purpose of this program is to provide information about basic skin care for people with eczema and sensitive skin, including the safest and most effective ways to bathe and moisturize.
What worked for us was soaking her in warm, not too cold, not too hot water.
Everyone knows that the goal of healthy eating is to maintain a healthy body. Likewise, the goal of healthy skin care is to restore and maintain a healthy skin barrier.
I use moisturizer every time I take a shower, so every day, at least once, and then before going to bed.
Armed with this knowledge, eczema sufferers and people with sensitive skin can enjoy the skin they're in.
It doesn't have to take over your life, and you can just live life the way you're supposed to.
More than 30 million Americans have a chronic form of eczema, including up to 20% of children and 3% of adults. That is 2 to 3 times the number of people who had it 30 years ago. 1 in 10 people with eczema have severe disease that drastically impacts their quality of life. To better understand what eczema is and how to care for sensitive skin, we spoke with Dr. Elaine Siegfried, a recognized authority on eczema and associated skin disorders. What is eczema?
The skin is an amazing organ. It contains sweat glands, blood vessels, and nerve endings, and has the ability to regulate body temperature. Healthy skin's like a suit of armor that protects the body from infection, irritation, and drying out. There are two main layers, the outer epidermis and the inner.